So let's look at some specific neonatal issues that we want to focus on and that we must be aware of in this period. Number one is respiratory complications. So remember that immature lungs do not produce enough surfactant. Surfactant is what allows the alveoli to remain open. From a physiological point of view, we'll discuss that in a full physiology lecture. But just remember, if you look at Laplace's law and the law of surface tension, okay, a bubble will want to collapse in on itself due to the surface tension forces. Surfactant breaks the surface tension up, allowing these to be open. So respiratory distress syndrome in a premature infant, especially below 28 weeks of gestation, is pretty much guaranteed. So the lack of surfactant, the need for artificial surfactant, complicates the ventilation. Remember, oxygen is toxic to them. Too much oxygen can cause bronchopulmonary dysplasia. We also need to keep in mind that premature neonates, though, have got increased oxygen requirements, roughly 6 to 8 moles per kilo per minute of oxygen versus 3 to 4 moles in adults and older children. So they desaturate incredibly rapidly. And if you think that an infant or a child gets a Brady when they get hypoxic, you've seen nothing in a premature neonate. Their heart rates are so exquisitely sensitive to temperature, to acidosis, to oxygen saturation, etc. It can be really spectacular and quite scary. And then remember that they've got unique respiratory parameters. They don't really have a great hypoxic respiratory drive. They don't really have a great hypercarbic respiratory drive. And everything we do in anesthesia causes apneas.